Good morning, Conference. Chair, Christina McAnea, UNISON, moving the motion on social care workforce. Conference, remember when Boris Johnson, and sorry, excuse my language, stood outside Downing Street and promised us that he had a plan to fix social care? And then in his final departing insult to the country when he was resigning, he had the cheek to claim that, like a rocket booster, he had fixed social care. Well, Conference, that came as a huge surprise, I think, to everyone who works in that sector or who relies on that sector. Because far from being fixed, social care is in a worse state now than it's ever been. It's propped up by underpaid and undervalued workers and exploited migrant workers. There are 160,000 vacancies in social care, and thousands of hospital beds are taken up by patients who need social care. But last week in Manchester, the Tories had nothing to say about social care. They have no plan now. They've had no plan for the past 13 years, neglecting everyone who needs it and ignoring all the workers delivering care to those who need it most. Now, I hear people saying Labour needs to be ambitious, and I completely agree. But, Conference, what's more ambitious than creating a national care service for this country? Transforming the lives of 1.5 million people who work in that sector, guaranteeing support for the millions and millions of people who depend on social care every single day, revolutionising one of the biggest industries in the UK, made up of a predominantly female workforce. And I also want Labour to be bold. So in its commitment to the first fair pay agreement, that will be in social care, a diverse and complex workforce, that is what being bold means. A fair pay agreement that will empower workers and their unions to get in there and negotiate pay, conditions and training for this incredibly valuable workforce. Now, you'll hear the Tories say, we get challenged on it all the time, we can't afford it. It's more unfunded, uncosted, frivolous socialist spending. Well, Conference, social care already costs a fortune. There's plenty of money in social care. If there wasn't, why would all these hedge funds in the Cayman Islands be investing in the UK social care structure? They're extracting profits from social care, pushing down standards, keeping pay down for those who work in it. And Labour's commitment is to stop those immoral companies exploiting care. Conference, we've now had 75 years of an NHS. Imagine if we were also celebrating 75 years of a social care service, a national care service. Well, under a Labour government, we have that opportunity to create that national care service, linked into the NHS, that gives people dignity, high-quality care, allows family members to stay in their jobs, gives care workers real opportunities, and gives the people who rely on care a say in what their care looks like. If you have a broken leg, you know where to go for help. You go to the NHS. But if you suddenly can't look after yourself, or your family are desperate for help, where do you turn? Conference, with a Labour government, we will answer that question. It must now be our shared mission that in the years ahead, we will be celebrating the birth of a national care service. And we can look back, those of us in this room now, and proudly say, we built that, just as Labour built the NHS. Thank you, Conference.